Hi, and welcome to another InVivo dental basics review session, talking about the features of your InVivo dental software. Today we're going to talk about volume rendering basics. We're going to talk about the volume render tab, spend some time on the different features and the abilities that you have to visualize structures and to present to your patients using this volume render tab. I'm going to start out with a brief review of the different rendering methods that we have available to us on this volume render tab. You see I've got this selected right now. I have a case from our Scanora 3D from Soridex, and we'll be using this case today as we talk about different features of this volume render tab. Right now, the default render method is what is referred to as teeth. This takes the Hounsfield units grouped around bony tissue, bone and teeth and so on, and it represents that picture in a way where the most dense materials are portrayed as being white and having a good deal of opacity to them. And the less dense the material, the more reddish tone it has, and the more transparent it is. This is a completely intuitive thing. When you take a look at this volume render, you can immediately tell what's dense and what's not. Your patients intuitively know when they take a look at this what it represents. You know, what is strong stuff and what is not so strong. And so this tooth render option is really a strong one for presenting to the patient. It's worth talking about here a couple of the review points for viewing images in this volume render tab here. A couple of key commands that you should always keep in mind. If we hold down the control key while we left click and drag with our mouse, we're going to zoom in and zoom out. If we hold down the shift key while we're clicking and dragging using the left mouse key, we're going to translate the position of the volume in space. And as we hold down the space bar and left click and drag, we're able to rotate this thing right in position. Of course, one of the neat features of this particular tab is that we've got the conventional view menu up here. So we can perfectly align our volume to the left view, left 3/4, straight ahead, right 3/4, right view, top view, bottom view, and from behind. All right, so we can very quickly change this. Now, one of the interesting things that happens in a previous tab here is that if we don't have our alignment properly set on the section tab, in other words, if we've altered the positioning of this, tweaked one of our parameters here using this reorientation tab, when we come back to our volume render and hit, say, straight ahead, it's going to line up to what you said was straight ahead on the last tab. So if you want things to line up perfectly here, we need to pretty much line them up perfectly in the section tab here. So, you know, positioning is non-critical when we're loading our patient into the chair here, but if you want stuff to line up in the software, then we've got the software tools to be able to manipulate that. But you do have to, you know, make sure that you've got stuff lined up in subsequent tabs here. Okay, so we're back on this volume render tab here, and we hit the straight ahead, and you can see that we're back to pretty much straight ahead. This is again the default view is this teeth view, and again the rendering method here. Our reconstruction here is handling this from the aspect of grabbing different Hounsfield units. We've got a couple of different methods here. So the quality does the best job here. Performance is going to render the quickest, so that we can spin things, so that we can illustrate, put a view sequence together to try to make a movie with the least amount of jerky motion here. We'll talk about that in a subsequent presentation here, but for today we'll talk about the different render methods here. Default is kind of halfway in between quality and performance. When we take a look at the reconstruction here, we've got the volume render, a maximum intensity, which again just is just as it sounds here, and then we've also got an X-ray rendering that softens it up and makes it look a little bit more like what an X-ray would appear. It has a little bit more depth to it. We're going to go ahead and put it on volume render, the default rendering method here. We can go ahead and choose some other rendering methods. Okay, so we can grab the Hounsfield units that are arranged around the mucous membranes and be able to define airways, be able to find airways pretty quickly. You see the sinuses that are within this view. Well, we could see the airway pretty well illustrated here. We could see a little bit of air trapped in the oral cavity, not a lot, but a little bit, and air inside the inner ear structures, pretty well identified and outlined in this. We can go ahead and combine kind of those two and come up with what's Anatomage calls soft tissue and bone one, where we are combining this air and airway and the tooth rendering. So we've got a pretty good idea of how airway and sinus relate to our bony tissue here. Of course, on all of these render methods, we have the ability to clip this volume. We can enable clipping by checking on the little checkbox, and we can clip to any plane that we wish. Right now we're clipping to the sagittal plane. So as I move my mouse roller here, I am moving my clip path on that particular plane. All right, as I roll back and forth, I'm clipping right on the sagittal plane there. If I want to look at the opposite piece of this, we can just go ahead and clip to flip. All right, so now you can see I'm halfway through here. I can also grab this little slider and clip that way too. So clip one half or the other half very easily. You can clip the axial plane, the coronal plane. We also have the capability of clipping what's called the arch path here. And as you see, as I move the little slider here, that we're not completely orthogonal with the arch, but we're close enough that you can see rough cross-sectional type of information as we're clipping along this pathway. Now, we don't have to necessarily clip a full half at a time here. All right, we're clipping along the whole pathway here. What we can do is clip in different slabs, and we can take a slice that's 5 millimeters thick. I'll go ahead and choose a sagittal again, and we'll put it so that our patient is facing directly at us. And as I move through the patient, we can see one 5 millimeter aspect of this sagittal plane. You can make that a 10 millimeter slab. Again, a good way for visualizing the relationships between structures here. 20 millimeters. When I was a kid, used to go to the Chicago Museum of Science and Industry, and there's a person that's been sliced up, donated their body to science, and they were sliced and sandwiched in between little glass plates, and the entire person looks like this in these skinny little slabs. I think it's about 5mm slices. So these are mounted, and you can see this whole person's body. This just reminds me of that every time I see this. So that's another way of visualizing these structures, of being able to relate these to a referring dentist or a patient as you see fit. Again, although the freeware viewer is not capable of doing these volume renderings, what you can do while you're working a case is continue to take gallery shots by going up to View and Capture to Gallery. We're able to title this what you see fit, and add any comments as you want to, and make that clip so the person even that can't see the 3D in their freeware viewer can look at your gallery and be able to see that exact same screenshot. So if you make notations or measurements, something that relate to the working of the case, you can leave that behind within that screenshot gallery. Another rendering method for this volume rendering is bone. And bone is a very typical look for 3D rendering. This is kind of coats the outer surface of the voxels that are related to the patient's tissue. You can see in our particular case in the Scanora where we've got an awful lot of bone competing for the X-ray energy that the sensor gets. In those areas, we tend to kind of have a lower degree of saturation of X-ray energy, and these get to tend to be burned out. But in areas where we don't have quite as much, the bone is rendered exquisitely. All right, so you can see down here in the mandible, we are really clean. One of the neat things that this rendering method opens up is the ability to do really cool cutaways using our Sculpt tool. And we've got a couple of different sculpting tools here. The freehand Sculpt tool is probably the easiest to relate to right away. All you do is click and hold your left mouse key as you move through, and again, freehand is just as it says. We can move through and draw any line that we want to, and when you release the left mouse key, we're left with a scissors, and depending on which side of the line you click the scissors tool depends on how you're going to cut this thing. So I'm going to go on this side of the scissor of the line that I've just described, and we'll use a scissors tool, and you can see that I just cut perfectly parallel to the line that I drew. We've created a plane that goes straight back in space, and so all of the tissue that is in the way has been cut out along that plane. So you can see I've made a pretty good cutaway of my mandible, and you can see what's inside there, the roots of that molar. You can see the cutaway section of my spine. All right, anytime you make a cut like this and you want to get back to where you were, you can go up to Edit and undo that, or we could go ahead and hit the Control-Z as a Windows command that you always have access to. All right. This is a pretty cool tool for cutting down on things that are not helping you with concentrating on what you want to see. Anytime you're working a case and there are distractions, right now I only want to see the dentition. Okay, great. All I need to do is cut all the rest of this stuff out of here and get it pretty clean right off the bat here. We'll we'll go ahead and clean it up a little bit more. Okay, I'm just using this freehand sculpt tool. In a second, I'll show you the other one. Working kind of quick here. All right, so in just a couple of little strokes here, we've cut away a lot of the tissue that's distracting from us seeing what's going on in the dentition. You can do a lot better job of cleaning this up, depending on how much time you want to take at it. All right, again, if I want to get back to where I was, all I need to do is undo or Control-Z, undo my cuts, and I'm back as good as new. By the way, if you save the case, even if you save as, with all that stuff cut away, it comes back without the cuts. So you're never going to, the downside to that is you're not going to be able to clean stuff up and save it. So when you clean something up, do a screen capture so that you can see the different aspects of that you want to see. But know that you'll always be able to get back to this point just by saving and reopening the case. All right. The other sculpt tool here is called the Polygon Sculpture, and this makes, as you click out points, will make straight lines. So we can use straight lines to make our cut. To stop creating points here and to get the use of our scissors tool, all you need to do is right click or double click, and then our scissors tool is freed up and we can make our cut. All right, this makes very clean, nice, sharp razor cuts here. In some aspects of working with this, it becomes desirable to put a marker in three-dimensional space. A marker will allow you to relate to that point in three-dimensional space no matter what, even if you sculpt away the tissue that it illustrates. So if we take this little marker point, we can place that in space, and that will continue to be there no matter what we do to this particular volume, even if we cut away that piece of the data. That point will still remain in space, so that we can continue to measure elements even as we remove them for expedience sake in working the case. So that's a pretty useful tool for keeping track of positions in space. Like any measurement, all we need to do is highlight that thing. It'll turn red, and we can move it, or we can edit it, or we can delete it as soon as it turns red. Another tissue rendering option here, kind of need to finish those up, I guess, is soft tissue 2 that hangs skin on our patient, and this is a really cool way of doing our clipping. If we enable our clipping here and clip on the sagittal plane, we can see a colorized gradation depending on how dense the tissue is. We can also fairly easily relate to air that's trapped in the airway or in the sinus passages. This is a very relatable thing for a patient to understand what's going on, particularly when their profile or their face is clearly visible on the rendering. All right. We also have the capability. I don't have a picture to show you here, but new versions will allow you to wrap a patient's face on that. New versions of InVivo Dental. So we can literally hang the patient's picture on this skin render. If we relate skin with the bone rendering here, we get soft tissue and bone number 2. Another very useful rendering method, depending on where we get to here, is called the inverse here. And inverse will obviously take things that are and flip them so that they aren't. So let's take a look here. Right now we're clipped, so our air trapped in the airway relates to us as being opaque. And the bony stuff relates to us as being transparent. This is most useful when we're doing sculpting with volumes that are where we've got sinuses, where we're trapping air inside, or airway or something like that. And in fact, when we're calculating the volume of sinus or something like that, it's very easy to use this inverse to do your sculpting and to figure out what the ultimate volume is. I'm going to do a little classic example here and show you the volume tool at the same time. I'm going to go back to soft tissue 1 here and turn my clipping off. I'm going to use my sculpting tool. And what I want to do is chop out the maxillary sinus here on the patient's right-hand side. So I'm going to take my freehand sculpting tool, and I'll just quick whip around the perimeter of my, oops, didn't want to do that, sorry. Here we go. Slipped. We can still proceed from here though. All right, so I cut away this piece. Now let's cut away a little bit more. Put it like that. Just using this freehand sculpting tool. By the way, I've been using a trackball for years. And a trackball, where you'd think it would be really great for doing this kind of thing, isn't really. It's kind of hard to do this. I find it easier for art kind of programs and photographic things, but it's really hard for this sculpting. All right, so now I've got my my sinus carved down here, and I'm looking at the mucous membranes. If I do the inverse, now I'm looking at the air that's inside this thing. So I could do a finer job of sculpting away the excess. And I'm going to twist this a little bit like this, and we'll just clean this up just a little bit more. And then we'll calculate the volume of it. Why would you calculate the volume of it? Well, imagine we're trying to figure out the volume of material that we need for a sinus lift. You're going to isolate the sinus, do the inverse, and then cut the sinus to the level that you think that you're going to fill the sinus. Let's go ahead and I'm going to twist this to the right 3/4 view here. All right, so presumably we would only be doing a sinus lift on the lower aspect of this thing. So let's take our Polygon Sculpt tool, and we'll just cut away all of this. So now we've got the piece, the bottom section, the bottom third that we want to fill with bone graft material here, and we can just go ahead and hit the volume measurement, and that'll calculate the volume of that. We can use these thresholds to reject non-air or things like that, but it's easiest to sculpt this to a aspect that's easier to work with. And now we know we've got just under 2 cc's worth of material, 1.85 cc's of material that we need to have on hand to fill that to the appropriate spot. All right, so it's a useful use of this volume measurement. And we also reviewed, what the inverse would be. If we go back to soft tissue 1, you see that that's the only thing left of the mucous membrane kind of rendering that we saw. Get back to our full person here. Couple of undos, and we're back as good as new. Another thing that you can do is preset your own by setting the custom. And if we set the custom, you can set colors. We can double click on this and change the colors that are rendering with it. You can use the preset kind of black to amber to white here, as they do for this. And you can base it on another one or whatever you want to. But we could go ahead and tweak the variables to come up with a new. And I have already established a custom rendering that makes it look a little bit brighter, a little bit lighter looking. The bone is a little bit more opaque here. So you see back to teeth. Here's my custom setting. And that's how we are able to set up our own preferences here on rendering and make that work for you. Another cool thing about this from an educational standpoint is the ability to be able to go ahead and put comments in place. We can, again, in three-dimensional space, we can attach a little point, and we'll call this, we can edit this. Let's see here, right here. Going to make this and we can work our way around and put many comments in here. I'm going to just go ahead and do 2 or 3 so that we can see the point that I'm trying to make here. We'll highlight this one so that we can edit it, and we'll change the annotation here to make it say and we'll put another one in here. You can do it right in the box too. Let's put in 2 or 3 more just so that you can see the distribution. All right, so now right now we're looking at what they're calling vertical round distributed. And as we rotate this thing in space, no matter how we've got this thing, the volume turned, these are going to follow this vertical distribution. They'll distribute it as best as they can, relating to the points. Now I can also go ahead and stick these horizontal, and they'll stay as horizontal as possible. I can say that they should stick to the point so that no matter how I turn it, they stay relative close to the point. We can go ahead and put vertical round distributed, and these things will kind of make a circle around the volume, no matter how we've got this thing oriented. So for measurements or notations like this, this is a really cool way of annotating and keeping things clear on your on where we've got annotations. And they will follow, no matter what, they will follow your anatomical landmark as you set them, no matter how you've got this thing oriented. We have a capability of overlaying measurement reticles on different planes. So if we click this grid button in multiple times, first time it's going to overlay on the sagittal plane a ruler. As we click this, now we're looking at the coronal plane. Click it again, obviously we're in the axial plane. I click it one more time and it's like the Nasion ruler on a lateral ceph. And no matter how big or how small you make your rendering here, we are going to see that measurement reticle tracking perfectly with and staying scaled to the volume data that we've got here. We have a capability of turning on and off this quick measurement. When we have the quick measurement turned on, reticle will pull into place no matter what your magnification is. 20 millimeters of span here so that we can get a quick little measurement wherever your cursor is. You just turn that off by clicking the button one more time. So you can see that we've got a lot of flexibility with this volume render tab. We are able to use this to really relate to our patient, to our referring dentist. Again, we can work a case by putting gallery shots in place. It doesn't matter that the person on the receiving end doesn't have the capability of spinning the skull in space like we've got right here. They're still going to be able to relate to the information that's put behind. Our next program is coming up in a couple of weeks here. It's going to be talking about exporting images, when to export a DICOM CT file from your reconstruction software, and when we should save our file and send InVivo with the freeware viewer. We'll talk more about that. That's scheduled for August 31st, so I hope that you'll join me at that point in time. If there are no questions, that's it for today. Thank you very much. Again, my name is Jim Liebenstein, and I'm the Sales and Service Trainer for Instrumentarium Dental and Sordex. Thanks for your attention, and hope that you enjoy using your InVivo dental software.